Hi, I'm Carla Schimmelfinnig, registered physical therapist, and welcome back to InjuryGuru.com. This is the sixth exercise in the shoulder exercise program number 1. In this particular exercise, you do need to have a stick or a wand is what we call it. I got this from just my local hardware store, and it's just a dowel rod. This cost me a few dollars, but I went up to my laundry room in a closet and found my broom and just unscrewed the end of the broom from this stick. And this stick then will work just as well as a dowel rod. So you will need a stick or something like this. I've had other patients tell me that they've used a golf club or even a baseball bat. So there are several items that you could use that you can probably find just around your house. For these particular exercises, I want you to perform these whether you have some just stiffness in that shoulder or you think you have actually lost some motion or mobility. These exercises are really, really important. They're really, really good. Some of my favorite exercises at this stage in the game. I want to show you real quick how you can just assess motion in that shoulder to determine if you have lost some motion or mobility. All of us should be able to reach straight up over in front of us so that our hands are pointing straight up toward the ceiling. And then as well, with our arms out to the side and all the way up. Again, hands pointing straight toward the ceiling. And then let me show you from the side, but you should be able to reach up and behind your back as if you had an itch you needed to scratch or you needed to fasten a bra. And then you should also be able to reach up and back behind your head along your shoulder. Now, you should have a good normal shoulder to compare that to, so hopefully you do. And just compare that to that painful side to determine if you have lost some mobility. What I find most of the time is in my clinic is when I see patients that they don't even realize that they have lost motion or mobility until I check that for them, and then they can see for themselves. So make sure that you go through that quick test to assess that motion. We're not seeing each other in person, so it's really important that you go through that test to determine if you have lost motion. If you have lost some motion or you just have stiffness, then these exercises are going to help you. They're really important, and I want you to make sure you include them in this program. So let me show you the first exercise or stretch with the stick, and it's called shoulder flexion or elevation. Let me show you shoulder flexion, shoulder elevation, or just simply bringing that stick up and over your head. Again, I don't really care what you call it as long as it looks like this. And that's it. Now, if you have motion and you're able to go that far, I always want you to go as far as you can without producing pain. That's really important for these particular exercises or stretches. Occasionally, when I start patients on this exercise, they can only go so far before that pain starts. And that's fine. I want you to go to the point of pain and then stop. So if you can only go so far, that's absolutely fine. So occasionally, when I have patients start this in the clinic, they, depending on the amount of pain they've been having or how long this has been going on, they may only be able to even lift that stick straight up in the air. And that's fine too. I want you to go where you are comfortable and where it doesn't produce your typical shoulder pain. Now, when you perform these exercises, I want you to try to do these twice a day for 2 sets of 10 to 15 repetitions each time. Again, making sure that you're stopping just before that point of pain and not forcing that. I can tell you beyond a shadow of a doubt, after treating shoulder patients for 25 years, that if you continue to force an exercise or exercises past the point of pain, you're only going to irritate that shoulder. So make sure that you're not going past that point of pain. So that's it for shoulder flexion with the stick or the wand. And make sure you view the next 2 videos that will show you how to perform 2 more exercises or stretches with the stick.